Welcome to Healthcare Channel. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. It is characterized by a wide range of symptoms, including hallucinations, delusions, disordered thinking, and social withdrawal. Schizophrenia affects approximately 1% of the world's population, and it typically first appears in people in their late teens or early adulthood. Causes of schizophrenia. The causes of schizophrenia are not fully understood, but research suggests that a combination of genetic, environmental, and brain chemistry factors may play a role in its development. Some of the factors that have been associated with an increased risk of developing schizophrenia include genetics. Studies have found that people with a family history of schizophrenia are at a higher risk of developing the disorder themselves. However, the genetics of schizophrenia are complex, and no single gene has been identified as a cause of the disorder. Environmental factors, exposure to certain viruses or infections, prenatal malnutrition, and complications during childbirth have been linked to an increased risk of developing schizophrenia. Brain chemistry, abnormalities in brain chemicals such as dopamine and glutamate have been linked to the development of schizophrenia. Some studies have also suggested that structural changes in the brain may play a role. Symptoms of schizophrenia. The symptoms of schizophrenia can vary from person to person and can be classified into three main categories: positive symptoms, negative symptoms, and cognitive symptoms. 1. Positive symptoms. These are symptoms that add to a person's experience of reality. 1. Positive symptoms of schizophrenia can include hallucinations, delusions, and disordered thinking. Hallucinations, seeing, hearing, or feeling things that are not there is a common symptom of schizophrenia. For example, a person with schizophrenia may hear voices that no one else can hear or see things that are not actually there. Delusions, beliefs that are not based in reality are known as delusions. Common delusions in schizophrenia include beliefs that one is being persecuted, that one has special powers or abilities, or that one is being controlled by outside forces. Disordered thinking. People with schizophrenia may experience thought disorders, which can cause their thoughts to become disorganized or illogical. This can make it difficult for them to communicate with others. Negative symptoms. These are symptoms that take away from a person's experience of reality. Negative symptoms of schizophrenia can include social withdrawal, lack of motivation, and a flat or blunted affect. Social withdrawal. People with schizophrenia may withdraw from social situations and isolate themselves from others. Lack of motivation. People with schizophrenia may lose interest in activities they used to enjoy and have difficulty starting and completing tasks. Flat or blunted affect. A person with schizophrenia may show little emotion or have a flat affect, meaning they do not express emotions in the same way as others. Cognitive symptoms. These are symptoms that affect a person's ability to think, reason, and remember. Cognitive symptoms of schizophrenia can include difficulty with attention, memory, and executive functioning. Attention. People with schizophrenia may have difficulty focusing on tasks or maintaining attention for extended periods of time. Memory. Schizophrenia can affect both short-term and long-term memory, making it difficult for people to remember things. Executive functioning. This refers to a person's ability to plan, organize, and execute tasks. People with schizophrenia may have difficulty with these skills. Diagnosis of schizophrenia. Diagnosing schizophrenia can be challenging, as there is no single test that can definitively diagnose the disorder. Instead, doctors rely on a combination of physical and psychological evaluations to diagnose schizophrenia. Physical exam. A doctor may perform a physical exam to rule out any underlying medical conditions that could be causing the symptoms. Psychiatric evaluation. A psychiatrist will conduct a thorough evaluation of the person's mental health history and current symptoms. This may include interviews with family members or caregivers who can provide additional information about the person's behavior and experiences. Diagnostic criteria. The psychiatrist will use the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, to determine if the person meets the criteria for a diagnosis of schizophrenia. Additional tests. In some cases, the psychiatrist may order additional tests, such as imaging studies or blood tests, to rule out other conditions that could be causing the symptoms. Treatment of schizophrenia. Treatment for schizophrenia typically involves a combination of medication, therapy, and support services. The goal of treatment is to reduce the severity of symptoms and help the person manage the disorder. Medications. Antipsychotic medications are the most commonly used treatment for schizophrenia. These medications work by blocking the effects of dopamine, a neurotransmitter that is believed to be involved in the development of schizophrenia. Some common antipsychotic medications include risperidone, olanzapine, and quetiapine. Therapy. Psychosocial therapy can help people with schizophrenia learn to manage their symptoms and cope with the challenges of the disorder. This may include individual therapy, group therapy, or family therapy. Support services. People with schizophrenia may benefit from support services such as vocational training, housing assistance, and social skills training. These services can help them maintain their independence and improve their quality of life. Pathology of schizophrenia. The exact pathology of schizophrenia is not fully understood, but research suggests that it may be related to abnormalities in brain structure and function. Studies have found that people with schizophrenia may have smaller brain volumes and reduced connectivity between different areas of the brain. Some researchers have also suggested that abnormalities in neurotransmitters such as dopamine and glutamate may play a role in the development of schizophrenia. Dopamine is believed to be involved in regulating mood and motivation, while glutamate is involved in learning and memory. Research has also identified a number of genetic and environmental factors that may contribute to the development of schizophrenia. Studies have found that people with a family history of schizophrenia are at a higher risk of developing the disorder themselves, and exposure to certain viruses or infections during pregnancy may also increase the risk. Thanks for watching.